Hi everyone, welcome to this workshop. This workshop is going to be on health promotion, nurse, physical, and mental health well-being. My name is Ruby Tolentino Rabina, and I will be your educator for today. I've been a registered nurse for over 13 years, and my bedside nursing experience includes med-surg, tele, emergency, emergency trauma, case management, discharge planning, utilization review, and care coordination. I received my Bachelor's of Science in Nursing from California State University, Bakersfield, and I'm currently in the Colorado Technical University Master's of Science in Nursing education program. Before I became a nurse, I worked in the mental health field. I had my degree in psychology, a bachelor's degree in psychology, and I worked with adults and children in the mental health field. I chose this topic because I feel that it is really important for nurses to take care of their physical health as well as their mental health in order to provide quality, patient-centered care. The topics presented in this workshop are important for all nurses, but this session has been designed for the nurse case manager. I currently work as a case manager for the emergency department at my organization. The role of the nurse case manager is to work collaboratively with patients, physicians, and interdisciplinary teams to coordinate a safe transition of care. There are situations that nurse case managers are involved in that can affect their physical and mental well-being, which can impact the care they provide. After taking this workshop, my goal is that the nurse case manager will understand how stress affects an individual's physical and mental health, be able to assess their current level of stress, how their nursing practice is affected, and apply interventions to reach a level of physical and mental wellness to provide quality nursing care that is safe and patient-centered. Let's go over the learning objectives for this workshop. In this workshop, we will go over Orum's self-care deficit nursing theory as it relates to self-care. The second learning objective will go over how and why self-care is important to a nurse's physical and mental well-being. And lastly, everyone will have an opportunity to participate in activities to practice self-care, such as mindfulness and reflection. This section of the class will focus on the second learning objective, which is related to self-care benefits on our physical and mental health. Before we continue with learning objective 2, let's do a quick recap of information presented in learning objective 1. The World Healthcare Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health worker. Nurses care for others. Nurses are not able to care for others if they are not able to care for themselves. Healthcare Organization's definition of self-care falls in line with Orum's self-care deficit nursing theory. This theory guides nursing practice as it provides a framework for nursing care focusing on an individual's ability to care for themselves. We also went over 3 theories that are involved in Orum's self-care deficit nursing theory. They are the theory of self-care deficit theory, and theory of nursing systems. Understanding Orum's self-care deficit nursing theory helps nurses understand their role. It also highlights the importance of nurses to take care of themselves. The nursing profession is at high risk for burnout due to the complexity of the profession. Whether you're a nurse on the floor, nursing administration, or in case management, there are heavy, complex patients or a mismatch of job demands that can increase stress levels. Consequences of burnout is job dissatisfaction and health concerns that can affect our ability to provide safe nursing care. Nurses provide care to others. Most of the time, they endure the chaos and the complexities of providing care, and in the long run, this can affect their physical and mental health. Nurses need to take care of themselves so they can continue to care for others safely. Nurses who promote their own physical and mental health aligns with the cues and competency of patient-centered care. Healthy nurses will be able to recognize that the patient and or their families are full partners on the treatment team. They will be mentally focused, present, in the moment to provide care that is compassionate. They will also be able to assess the patient's preferences, values, and needs to advocate for the patient. Okay, that was a quick recap of information presented in the first learning objective. Now we can focus on our second learning objective. Today we will focus on learning objective 2, which is related to the benefits of self-care on our physical and mental well-being. We will go over stressors and the effects on nurses if self-care is neglected, what self-care is, and self-care goals. At the end of this session, there will be a 5-question quiz, and we can go over the answers as a class. There are stressors in the workplace. Difficult or increased caseload. In inpatient case management, caseloads can have multiple complex cases, barriers to discharge, or limited resources. In emergency department case management, there aren't caseloads that are assigned, but the ED case manager can have multiple complex patients in one shift. During the COVID-19 pandemic, the case management team was short-staffed due to sick calls. With case managers out, other case managers were assigned more cases. Communication is important in case management. Communication is done with management, the patient, the caregiver or family member, the physician, and the treatment team. Lack of communication can be stressful. For example, a patient in the emergency room has plans to discharge home with home IV antibiotics. The nurse case manager would have to coordinate a safe discharge, which requires communication with the patient to obtain consent, the caregiver or family member to confirm patient support, home health nursing for hospital support for the patient at home, communication to the home IV infusion team to ensure medication delivery, communication with the PIC team to confirm that the PIC line will be placed or has been placed. Lack of communication from any of the team members can cause a delay in discharging the patient home, which then can increase the nurse case manager's stress levels. Nurse case managers have guidelines and protocols to follow. When guidelines and protocols are not clear, management involvement and support is necessary. When there is lack of support, the nurse case manager's stress levels can increase. An example of complex job demands is when a nurse case manager is having to work through patient and family conflicts to coordinate a safe transition of care. Working with others can be stressful. Nurse case managers often have to cover other patients when the primary case manager is off for the day. It is important for the primary case manager to have completed an initial assessment and have a tentative discharge plan so that the covering case manager can pick up where they left off. When this is not done, the covering case manager is having to initiate the discharge planning assessment if the patient is ready for discharge for that day. The nursing profession is at high risk for burnout, and the environment can have multiple stressors. What are some of the stressors that you've encountered in the workplace? We can spend a few minutes to give the class an opportunity to share stressors they have experienced in the workplace, but for the sake of time, we're going to move on to the next section of this workshop. Stress can impact our physical well-being. One of the consequences of stress is illness, getting sick, chronic health conditions such as hypertension and obesity. Pain is another physical consequence of stress. Back and neck pain, abdominal pain, headaches, and migraines. Stress can lead to increased fatigue, disruptions in sleep patterns, and decreased energy. Stress can also impact our mental health. Nurses want to provide the best care for their patients. When nurses have to manage complex cases with little support, there is a mismatch in job demand, which can increase the nurse's anxiety. When there is an increase in job demands, nurse case managers may feel inadequate, which can result in feelings of depression. Stressors can decrease our attention and concentration on our patients. Stressors in the workplace can be so overwhelming that it can affect the care that we provide to our patients. Unmanaged stress can distract nurses. Thoughts can focus on the stressors and not on our patients. Hyperfocusing on something somebody said to you during your break or something a physician said to you regarding care can be stressful and distract case managers from planning a safe transition of care. Distractions can make you miss information about patients or their environment, which can affect the patient's discharge plan. Nurses are not present in the moment. Errors can occur. In case management, nurse case managers working on multiple patients discharging from the hospital or working on a complex discharge are at risk for making errors. If nurses are distracted or not in the present moment, a thorough assessment is not conducted, and this could result in patient harm. For nurse case managers to provide quality nursing care that is patient-centered, they need to be able to analyze and value multiple dimensions of patient-centered care. They also need to be able to identify barriers of patient or family active involvement in their own care. They also need to be able to communicate effectively with patients, families, physicians, and treatment teams to advocate for the patient and plan for a safe transition of care. Unmanaged stressors are barriers to providing safe, quality, patient-centered care. How significant are preventable healthcare errors? Our next slide is a video of a QSense safety conference with information on the number of healthcare errors reported annually and the importance of nurses to be attentive and focused to prevent healthcare errors.
Long way yet to go. So just in the context of what I'm going to talk about, I'd like to talk to you about how has a long way yet to go. So just in the context of what I'm going to talk about, I'd like to talk to you about how hazardous is healthcare. So we know that airlines and railroads and nuclear power plants are considered ultra safe. Isn't that interesting that they would be considered ultra safe? And we're glad that they are. And driving gets to be a little bit more risky. It's regulated, but sometimes we choose to go faster than speed limits and other things, so it becomes a little bit more hazardous. But the thing that's really interesting is healthcare is the most risky of things, and this comes from Lucian Leape's work, and it's as dangerous as mountain climbing and bungee jumping. So in 1999, 2000, we heard the report that 45 to 98,000 people died from preventable harm, and we called it medical errors. I'm on a mission to change that to healthcare errors, because when the public hears the word medical, they really think about it being our colleagues in medicine, but in actuality, it belongs to all of us. So now, John James, after an adverse event with his own son, re-examined that data and other data, and he has found that up to 400,000, he believes it's probably more, people die from preventable healthcare errors. I have an incredible time with numbers, and so it's really helpful for me to be visual. In Arlington Cemetery, the national cemetery for the U.S., holds 400,000 graves. So when you think about that, 400,000 graves are filled every year. In essence, we fill Arlington Cemetery every year with preventable harm. That is not acceptable. Noticing. Noticing is integral to the everyday practice of nursing. It is the precursor for our clinical reasoning. It informs our judgment, and it's really the basis of our care. By noticing, the nurse can be preemptive with the possible risk and support subtle changes towards recovery. We do noticing every day, all day long. It's a natural act. We notice the weather, the price of gas, the sound of a lawnmower. It involves all 5 of our senses. We're exposed to a vast amount of stimuli, too much to absorb, and we cannot notice all the stimuli around us. That's just in the natural world, but how much more so in the healthcare system? What we notice, what really captures our attention, is selective. And often we notice that which has the most relevance to us. So we will notice the weather this week if we're going to have a picnic on Friday. We notice the things that really matter. So Tanner actually has used noticing in her model of clinical judgment, and in this is actually the very first stage of her model. Noticing is a prerequisite to nursing action. So how do we help our learners to go from noticing to doing? We have to do that in training. We have to do it with patterns and meeting and have them recognize what are patterns and know what they are. We have to also ask them to always be thinking, what's the worst it can be? So that they know to be looking for what is not obvious yet to them. And also avoid anchoring and premature closure and confirmation bias. And I'm going to actually talk a little bit more about that as an example in a case. Another thing that keeps us from noticing, I think, is fatigue and distractions. So if we think about working 12 hours, let's say you're at the end of your third 12-hour shift, how much energy and cognitive ability do you have to notice? And I think that that is contributing to some of these errors that are occurring. And the issue that I have is we went to this because we thought it was a better staffing pattern. How do we go back? How do we go back? Because we have evidence, as Jane Barnstein even alluded to as well, that 12-hour staffing is not the thing that we need to be doing because it's putting patients at risk. Good nurses can't notice when they're exhausted, much less do anything about it. We also have to give learners a voice and able to speak up when it's time to speak up. We have to help them to know communication, collaboration.
The number of healthcare errors reported annually is concerning. There are things that we can do individually as nurses to help decrease the amount of preventable healthcare errors. She spoke briefly about noticing. Nurses must be focused and attentive to their patients and the environment to help decrease the risk of healthcare errors. When nurses are focused and attentive, they can intervene to prevent errors from reaching the patient. We can take a few minutes for the class to share their thoughts, but for the sake of time, we're going to move forward. The next video is from the documentary Chasing Zero, Winning the War on Healthcare Harm. Here we'll meet Julie. She will talk about the event she experienced as a labor and delivery nurse.
I wanted to work as a nurse and with babies since I was a little girl. In 1990, I graduated from nursing school. I had 4 little babies. Up until about 4 years ago when this happened, my life was full of babies. On the 4th of July, I worked a double shift, and we were busy, and it was almost 1 a.m. before I was able to kind of wind down and leave. And I lived a long way from the hospital, and I decided I was too tired to drive home, and I needed to be back in a few hours to do the day shift I was scheduled for. And so I laid down in a patient room on a patient bed and tried to sleep, and got up to start the next day. And at 9 o'clock, I met the patient. She was just a very young 16-year-old girl, and she was so scared. The plan was that they were going to break her water and start some Pitocin, and she was going to deliver her baby.
Julie followed nursing unit guidelines designed to improve readiness of patients for anesthesiologists to give an epidural injection. She adhered to the checklist of the guidelines and prepared the anesthetic medication at the same time that she had antibiotic medication ready to go. A number of systems flaws contributed to Julie's absolutely predictable human error.
So I got her IV, her antibiotic, and her epidural bag. Both bags had ends that received IV tubing. I had her antibiotic in my hand. I knew that. But I didn't have her antibiotic in my hand. I had her epidural medication in my hand. And after it started running, I heard a sound and turned to her bed, and she was already arresting. People came to the room immediately, many people. Dozens of people who were familiar with both of those medications that we used. Everyone saw that hanging there. In fact, I said, I just hung this antibiotic, and I think she's reacting to the penicillin. And then someone cleaning the room found the bag. They brought it to me, and they were crying. They put it in my hands. And it didn't make sense for a while. And I kept looking. And then it just...
What are the contributing factors to that healthcare error? Julie worked a double shift the night before. The medications look similar. Likely, it was fatigue that limited her from being in the present moment, and failed safety systems. The error reached the patient, and the patient died. The class will have an opportunity to share their thoughts, but for the sake of time, we will move forward. So, what is self-care? Self-care is any activity that a person engages in to reach optimal and physical mental wellness. These activities can help reduce stressors and promote and maintain physical health and mental health. Relaxing activities include listening to music, playing a musical instrument, or singing along to a favorite song. Some people enjoy going to the gym or going for walks or hiking. Getting regular exercise can help with moods and improve our physical health. Others may enjoy going to the movies with friends or family, watching their favorite show at home, or going to a musical. Some people prefer reading a good book or journaling. Whatever activity you enjoy doing can help you with your physical and mental health. What are some things that you all enjoy doing? The class will have an opportunity to share, but for the sake of time, we will move forward. What are the goals of self-care? One of the goals is to reach optimal physical and mental health, decrease or manage stress, and decrease anxieties. Another goal is to have positive relationships with our coworkers and our patients, and have a home and work-life balance. Okay, to review the information that we went over in this session, we're going to do a short quiz. The first question is, self-care can A, improve physical health, B, decrease physical health, C, increase nurses to sign up for extra shifts, or D, decrease motivation? Self-care can A, improve physical health. This next question is, with self-care, stress and anxiety are A, increased, B, decreased, C, equal, or D, not affected? The correct answer is decreased. With self-care, stress and anxiety is decreased. The next question is, self-care A can help manage stress, B is stressful, C does not affect stress management, D does not apply to me. The correct answer is A can help manage stress. Self-care can help manage stress. Okay, this next question is, self-care can blank my energy. A, increase, B, decrease, C, does not affect, or D, limits? The correct answer to this question is A, increase. Self-care can increase my energy. Okay, this is the last question. Self-care can help nurses A, be mindful and attentive in patient care, B, decrease preventable harm, C, provide patient-centered care, or D, all of the above? The answer to this last question is D, all of the above. Self-care can help nurses be mindful and attentive in patient care, decrease preventable harm, and provide patient-centered care. Okay, and we are done with Learning Objective 2. Our next session will focus on Learning Objective 3, and the topics that we are going to go over in that section is healthy nurse equals patient-centered safe care, incorporating self-care, coping strategies, reflection, healthy eating and drinking, physical activity, stress management, spirituality, mindfulness, and we can go over some apps that are available to help with self-care. I wanted to conclude this section with a quote from Carlos Wallace. He says, "Our lives are so busy, and for many of us, the demands are overwhelming. Some of us focus so much on the needs of others, we lose sight of ourselves. Stop for one moment, take a deep breath, be still, refocus, concentrate on improving your life, one situation at a time." You can't be much good to others if you're no good to yourself. If they love you, they'll understand. Okay, does anyone have any questions about any of the topics that we discussed today? If there are no questions, I want to thank everyone for being a part of this workshop, and I look forward to seeing everyone in the next session.